So my researcher is Dr. Joel Ringdahl, and this presentation is about some of his contributions to the field of ABA. So we're going to start with just a little history of Joel Ringdahl. At the top is his education, where he got his bachelor's, master's, and doctorate. On the bottom, you can see some of his career history. He started out as a clinical psychologist. He's been a professor at a few universities and a research scientist. On the next page, you'll see his current career. He is a professor at the University of Georgia and is serving on a 4-year post with the National Institute of Health Study, reviewing grant applications. On the bottom of this page, you can see some of the awards and honors that he's earned. On the next page, we're going to take a look at what he's studying. So some of the common themes in his research are manding, functional communications training, stimulus preference assessments, functional behavior analyses, and most of his studies center around severe problem behavior, such as aggression and self-injurious behavior. Also, on the next slide, these are some of the things that I saw come up a lot in his research studies that relate back to the concepts that we're learning in class. Non-contingent reinforcement, differential reinforcement of alternative behavior, differential reinforcement of other behaviors, functional communications training, automatic reinforcement, and extinction procedures. So next up, we're going to look at, this is the first study that I looked at from Dr. Ringdahl. This is about signals enhancing the suppressive effects of non-contingent reinforcement. What he was looking at here was that non-contingent reinforcement, as it's being thinned, can often lead to severe problem behaviors like aggression. So what he did was he started using a timer to signal when the next reinforcer would be delivered as he was thinning the non-contingent reinforcement. And he found that using the timer as a signal decreased that problem behavior. So how did that contribute to the field of ABA? Practitioners now know to use a signal, or some kind of signal like a timer, to indicate when the next reinforcer will be delivered when thinning reinforcement. And Google Slides is moving just a little bit slow today. So this next study that Dr. Ringdahl did was working with a patient who was engaging in covert stereotypy. Covert stereotypy is maintained by automatic reinforcement. Behaviors that are maintained by automatic reinforcement can be very difficult, if not impossible, to decrease because extinction procedures are very difficult, if not impossible, to use. So what Dr. Ringdahl did was he used a fixed interval DRO schedule. What happened was he and all other adults left the therapy room. The participant was left alone in the therapy room and needed to make a certain amount of time to get the reinforcer. So he originally started by setting the time low and gradually increased it to 10 minutes. And what he found was that as he increased it to 10 minutes, the patient was able to make 10 minutes without engaging in stereotypy. So how does this contribute to the ABA field? Practitioners know that a fixed interval DRO schedule can be used to help decrease behaviors that are maintained by automatic reinforcement. Just a quick fact that I mentioned here at the bottom, that most of Dr. Ringdahl's research focuses on aggression and self-injurious behavior. This was the only study that I found that he addresses engagement in stereotypy. This next study focuses on the effectiveness of functional communications training. What Dr. Ringdahl did here was he examined the use of various man topographies in functional communication training, since not every learner is going to have the same preference for man topography. So he took several different types of man topographies and offered each one to his participants to determine which one each participant was going to like best. Then he used the participants' preferred man topography with them. And what he found was that with all three of his participants, when he used their individual preferred man topography, their problem behavior decreased quite a bit. Now, how does this contribute to the field of ABA? It further demonstrates that functional communications training is effective as replacement behavior for problem behavior like aggression. It demonstrates that functional communications training and man topography should be explicitly taught to the learner, not just given to them and say, use this. and it demonstrates that man topography should be differentiated to fit the unique needs of each individual learner. It's not a one-size-fits-all approach. And you can see just at the bottom some of the different types of man topographies that were used. A break card, an adaptive microphone, and Alpha Smart Neo, and hand signals. So in this next study, Dr. Ringdahl explored the use of differential reinforcement with and without instructional fading. Instructional fading is what a practitioner will use when beginning to work with a brand new learner. And what it means is that they'll begin with little or a lot of times even no task demands, and then gradually increase those task demands as time goes on. In this study, using instructional fading decreased problem behavior to 0.0 responses per minute. So this contributed to the ABA field by demonstrating that instructional fading is effective when beginning treatment with a new learner, and it demonstrates that the learner should be taught that the practitioner should be teaching learner appropriate behavior at first, and then gradually introducing task demands as time goes on. In this next study, Dr. Ringdahl was trying to determine the function of aggressive behavior in a single participant, Lisa. The interesting fact that I found in this study was that 4% of the time, functional analyses can't determine the function of a behavior. So in this case, what Dr. Ringdahl noticed was that his participant kept attempting to leave the room. So he began to use that as a reinforcer. He used 30-second walks as a reinforcer, and through non-contingent reinforcement functional communication training and DRA being used in separate trials, he was able to determine that the function of her aggression and attempts to leave the room. When he started implementing the DRA and the FCT procedures, he saw there was initial burst in aggression, but that over time, her aggression decreased to near zero. The contribution that this study made was that it further demonstrates the need to determine the function of a behavior when first implementing an ABA treatment. The four main functions of behavior being attention, escape, access to tangibles, and sensory stimulation. And it also showed how the use of non-contingent reinforcement, differential reinforcement of alternative behaviors, and functional communication training can assist in determining the function of a behavior when a functional analysis can't. So these are some of the patterns that I found in Dr. Ringdahl's research. The top portion is basically from an earlier slide where I found that manding, functional communications training, stimulus preference assessments, functional analyses, and severe problem behavior are common themes in Dr. Ringdahl's research. A couple of things I found that didn't fit the pattern was he was second author in a study investigating hearing aid compliance. So that's not a kind of behavior that Dr. Ringdahl normally investigates in his studies. Also, the study that I talked about earlier in this presentation about the learner engaging in covert stereotypy is another behavior that stereotypy was another behavior that I didn't see him researching at any other time. So here are some of the resources that I've used to complete this paper and presentation, and I'm sure that Google Slides will load them soon. So I'm just going to take you through the 3 pages. As I said, it's moving slow today.